Today my presentation is on using the PBIS framework to meet the mental health needs of youth in juvenile justice facilities. My name is Brian Boyd and this is for EDCO 545. So first off, I want to talk about what my research question is, or what the research question is from this article. And so what I had understood from this article is how to interweave facility-wide positive behavioral intervention support, FW PBIS, by using data-based decision-making process to guide the implementation of tiered evidence-based interventions, as well as offer implications for practice and research. So from this class, we've been talking a lot about, school-wide PBIS implications and intervention. This article focuses predominantly on a clinical aspect for a juvenile justice facility. So that would mean, youth incarceration or other types of mental health facilities, focusing on tiered support for those suffering from mental disorders. So the sample of my article focused on youth with mental health needs manifesting their needs through behaviors that include aggression, hyperactivity, impulsivity, withdrawal, or behaviors that are not age appropriate. It is also under the age of 18 that are incarcerated in a juvenile justice facility, and it's ranging from Tier 1 to Tier 3 in levels of need for intervention. The design of this study was not so much based on an actual, a sample size and a hypothesis and ways to perform an actual study. It was more so based off of seeing the results of implementation for tiered support within the levels of severity within a facility-wide structure. So the MTSS framework is a three-tiered model that utilizes data to guide the implementation of evidence-based interventions that increase in intensity to meet each youth's specific needs. So from Tier 1 is the universal, right? It's common behavioral issues, sometimes hyperactivity or defiance, right? And then going to Tier 2 is more specific. It's those included in Tier 1 that also need additional support. And then Tier 3 is the most severe and includes the persistent needs of these youth. So the data is continuously collected and monitored across all tiers, and it identifies trends and guides all the decisions related to selecting implementation interventions. So one of the things that this study really pushed for was using data-based collection as to informing the facility itself in which tiered level of support would be most effective per their demographic or their population. So the ways in which they screened for these these youths would be as followed. So Tier 1, right, is a youth screening instrument. Tier 2 is the strengths difficulties questionnaire. Tier 3 is data from individual therapy sessions, right? So all of these things are incorporated with each level or tier of population, only the difference is from the data collected is how they know to proceed forward with the types of interventions that are needed. So the results of the studies itself was actually pretty interesting. So as we are aware, PBIS is really, really helpful and beneficial in a school-wide setting. In a juvenile justice facility, one of the things that it really focused on was that all the people involved in the care and treatment of these individuals need to be on the same page, right? They all need to have this framework of support that all pieces of this frame are actually working together, right? So basically the masses can address the complex symptoms. Throughout every level of care, practices should be consistent, build upon previous practices, and be embedded as part of a facility-wide tiered system. And using a tiered framework to guide facility-wide mental health services can result in improved emotional, behavioral, social, and mental health outcomes for most vulnerable youths. Right? The goal here for any intervention with students or with youth is to make sure that these students are going to be okay, that they're going to be able to process their traumas or their day-to-day lives more effectively and feel supported in doing so. So some generalizations about this study itself is basically how to correlate facility-wide based with school-wide. I think that it's important, and sometimes we forget that kids don't always end up in schools, right? I mean, there are plenty of facilities that house student-aged youths that are suffering from some very severe mental health issues. And so remembering that these are still kids, but finding a way to, implement positive and beneficial interventions, I think is really key. And so, they're kids overall. I mean, right, that's the goal here, is to make sure that they're able to feel supported. Some reflection questions that I have for this article is, comparing schools to this facility-wide PBIS is how do we get the school on the same page? How do we get parents, teachers, the support system itself to all be working together for this student and make sure that they're, overall supported on all angles and from every aspect. So from this facility-wide based training, I think it's really important to ask, how can we make it effective? How can we make it poignant? And how can we make it easily accessible for both parents and teachers to get this training so that we're all on the same page, right? I think that when it comes to kids, the most important objective is to make sure that the student or the child is safe, right? That's our goal. That's our objective. And getting that information to the people that are most necessary is really vital. So these are my references. Thank you so much.